name is Max Mendez, and I'm from Respiratory, and I'm going to show you how to do trach care. So first, you verify the order that the patient needs trach care. Once you verified that, you proceed. You come in, and you introduce yourself and why you're here. Once you've introduced yourself, you want to identify the patient. You identify the patient by looking at their brace, making sure it's the right medical number, their name, and their date of birth. Once I've identified my patient, I can start the process. So I'm going to wash my hands. Okay, so the next thing I'm going to do is I'm going to go ahead and sit my patient in Fowler's position to begin with my vital assessment. Semi-Fowler's. Okay, so I have my patient up. I'm going to go ahead and check his respiratory rate, his heart rate, and I'm checking for breath sounds also for an indication of suctioning. Check my breath sounds. Patient is bilaterally clear, no indication for suctioning. Proceed with the trach care. So I come open my kit. First thing we're going to find is our sterile gloves. Set these to the side for when needed. Okay. Next, I have my sheet that's going to set my sterile field, making sure that I don't touch the sterile side. Like this. And I also have a drape for my patient so he doesn't get all messy. So I come and I empty my products. Okay, so I need a 50-50 solution of hydrogen peroxide and saline mixture. So without touching anything else, I give my hydrogen peroxide, put some here, dispose, my saline here, so now I have a 50-50% solution, and then the rest of the saline I'll go ahead and put into the extra 2 containers. So once that's done, I'm going to go ahead and put on my sterile gloves. So you want to keep dirty with dirty and clean with clean. So my first one, I'm going to go ahead and just grab it here. Careful not to touch the clean side. And now, clean with clean. Now since both my hands are sterile, I can go ahead and fix it. Now I got my sterile gloves on. I'm going to go ahead and come to my patient, and I'm going to remove his inner cannula. Once that's removed, I'm going to go ahead and put it in a 50-50% solution. Then I'm going to come, remove his old drape. Dispose of this. Then I'm going to grab a swab here, some hydrogen peroxide solution, and clean all around the stoma. Making sure you get all the cracks. Alright, dispose of that. Then you're going to go ahead and grab another cotton swab and just kind of rinse everything off with just saline water. As well, all between the stoma and all the little areas. Dispose of that. Now what I'm going to do is go ahead and clean his inner cannula with my brush. This brush allows you to get into small areas. Clean that. Rinse it in saline water and set it out to dry while I change or put on a new dressing for him. New dressing is on, and I also have to change his brace that is holding his trach in place. So I can go ahead and do that now. Okay, so now my patient has a clean area to prevent infection. Alright, so this should be dry by now. I'm going to go ahead and insert his inner cannula once again, making sure it's locked to hear that click. Okay. So once he has that, I'll go ahead and remove this, dispose as well. And I'm going to go ahead and reassess his vitals, heart rate, respiratory rate, breath sound, making sure, monitoring it, making sure that nothing goes wrong, that he tolerates the procedure well. Still bilaterally clear, indicating that the patient has tolerated well and there's still no need for suctioning. I ensure my patient's comfort and make sure he needs nothing else. And then go ahead and remove your PPE properly, disposing in a biohazard container. Getting rid of all of this stuff, and then you go ahead and chart your procedure, and that is it. That's how you perform trach care. Thank you.